Hi, everyone. TGIF. Oh, wait a second. We are blurry here. 1 second, everybody. I'm going to clean this. Let's see. Can you clean that? 1 second. We should probably do that before. There we go. Okay. Okay, we'll put that on the list to do before we start the webinar. Hi, everyone. I'm Dr. Latowski. Thank you so much for tuning in to our webinar today. I'm going to talk to you about a favorite summer treatment. This is a device called SoftWave. It is an energy-based device. It is the treatment for the summertime. Why? Because you can do it and go to a pool party right afterwards. We don't care if you're tan. Of course, as a board certified dermatologist, I recommend you not tan, but we don't care if you're tan. We don't care if you go out in the sun afterwards. It's completely safe to do. And I want to tell you about this technology. There we go. All right. So what is this technology? In this photo, you see our lovely Meryl with this device, and you're going to see this a little bit later. This device is ultrasound, and it creates collagen. So it goes into the skin, it heats the skin at the level of the collagen. And so when it does that, there is new collagen and the old collagen remodels. It also stimulates something called elastin, which makes the skin nice and elastic and supple. It basically makes it have a more youthful look and feel to it. When this happens, the facial lines will improve, the wrinkles will improve, and we also get a lift. So I often talk to patients about multiple different treatments. We are very lucky to have several different treatments available for our patients. And when I'm talking about treatments such as laser, and SoftWave, I will distinguish the two by reminding people that SoftWave does more lifting for the skin. Laser can help with crinkling. A lot of times, both technologies help with collagen and elastin, and some fillers and collagen stimulation. So some regenerative medicine like Radiesse, like Sculptra, they help with collagen and elastin. But the SoftWave is going to use energy to give us a really nice lift. And that is why it's one of our absolute favorites. So by the way, what is collagen? Collagen is a protein in the body, and it actually is really abundant. It accounts for 30% of protein in the body. And I actually think that this is why when people start taking collagen supplements, that they can see improvement in their energy levels and their hair, nails, and skin. I think it may have to do actually with getting more protein in our diet, which sometimes we neglect, especially women tend to neglect this. And the older we get, the more important it is. So anyway, collagen is responsible for keeping the skin tight, giving us that youthful glow. Remember that glow that you had in your 20s? It helps to bring back some of that, and it keeps us youthful looking. So when you go check in for your doctor's appointments, the receptionist is not going to believe your age. And that just happened to actually 2 of my patients in the last week. 2 separate patients told me that it's a very similar story, that they were questioned by their doctor's offices. And these are people who see others all the time and know everyone's ages. And you can see, and they said that the receptionist just didn't believe their age. So this is a result of new collagen. As time goes on, we produce less collagen. And so we need to replace the collagen that we're losing. And we can do so by supplementing it with these devices, such as SoftWave, such as laser, such as Radiesse, and Sculptra. And we're focusing on SoftWave today. So here we go. This technology is hyper-focused to go into the middle of the skin, called the dermis, and it goes to the mid-dermis, 1.5 millimeters in the dermis. And this is exactly where we want to go for all the magic to happen. And on the device, there is a cooling plate. So that protects the top layer of the skin. So the top layer of the skin, and that's where the melanocytes are, the cells that produce color. The top layer of the skin is completely protected and unaffected. And that's why the Softwave is safe in all skin types. And if those melanocytes are activated by the sun or someone has a tan, and fortunately for us, it doesn't matter because that layer is unaffected. So how does it feel? Well, you can see my medical assistant getting this treatment in this photo, and she looks quite comfortable. It is okay. Treatment is hot. And I find the more that you do it, the more comfortable it is. So the treatment, it can range from uncomfortable to comfortable, but it's not terrible. And we have ways to make it as comfortable as possible. So basically, it feels like heat. The uncomfortable portion lasts a split second, and then everything just goes back to normal. So there's no lingering pain, soreness, burning, etc. And so it's very, very easy to do. We have the treatment, we leave feeling completely normal, and our skin looks better even when we're leaving. So if you're sensitive to pain, you will not have an issue with this. If you're not sensitive to pain, you're going to think this is easy. We use laughing gas during the treatment, and sometimes I will numb patients. Not everybody numbs, but sometimes I will numb, and sometimes that helps. And then the laughing gas delivered through this device called the Pronox will also make you very comfortable and relaxed. And true to its word, it usually makes you laugh. So how is Softwave? How does it distinguish itself from other technologies? Well, as I mentioned earlier, lasers can be aggressive, and therefore they can have safety risks. They can have downtime. We definitely restrict sun with all laser procedures and recommend you not get laser around the time of a sunny vacation, a lot of times during the summer in Arizona, and if you are in the sun a lot or have an active tan. And there are not any restrictions. So I have my patients who do not want to give up their pickleball. They do not want to give up their social life. And as I mentioned, you could have this done and go right to a pool party, go right to, well, I was just glancing at the Softwave, social media, and they were performing the Softwave before the Met Gala. So they were giving everyone a little glow up before the Met Gala and just sending people right to the Met Gala after the treatment. So super, super easy treatment to have. And again, to summarize, why do we love this technology? The side effect profile is very low. The efficacy, it has predictable, reliable results. Safe for all skin types and skin tones, no restrictions, no downtime, no aftercare. Super, super easy. As we talked about, we're going to reduce the appearance of wrinkles. We're going to lift specifically the brows, the lips, and the neck. It is quick and convenient. And of course, no downtime. I like to recommend at least 2 treatments. If you see this treatment advertised, you might see 1 treatment recommended. That's because the FDA trials were done using 1 treatment. What does that mean? That means after 1 treatment, we saw enough improvement, or the investigators, I was not a part of that trial, the investigators saw enough improvement where they could get FDA clearance on it. So even 1 treatment will get you results. So 1 is good, 2 is better. And more is even better than that. So some patients will do this treatment, patients, including myself, will do this treatment multiple times. I've had the treatment like 3 or 4 times, and the more you do it, the better the treatment is. But for most patients, I'm recommending 1 treatment, then repeat this treatment, do another treatment 3 months later. And then if you choose to maintain this treatment, do it annually. Now, sometimes we do two soft wave treatments 1 year, and then the next year we might do a radio frequency with microneedling treatment like the Agnes, and the next year we might do a Fraxel. So we can also mix and match depending on your needs. And that's where we come in. We will help guide you, help make this decision. But for our patients who love soft wave, we're going to be recommending once a year. So we discussed that. Is a soft wave right for me? Yes, it is. It's really great for patients. Patients in their 30s tend to get an amazing result because they're starting to see some aging, and any improvement is very noticeable improvement. We have treated patients in their 60s, 70s, and even 80s with success. So this treatment basically works for everyone. And as you see from some of our slides, of course, our beautiful, lovely staff were the first people to get treated with this device. And so you will see even people in their 20s getting benefit from this device. So we talked about Pronox. This is laughing gas. And this is a very kind of sci-fi looking device, but basically this delivers nitrous oxide to you, and you just use it when you need it. So it's out of your system within 3 minutes when you leave. So you don't need a driver, even if you use the Pronox. Sometimes patients are worried about ultrasound waves, or maybe they get ultrasound waves and x-rays confused, but ultrasound waves are completely harmless and have no radiation. So it's a very safe treatment. This treatment will give you extremely natural look. So you look like yourself, just how you looked a couple years ago. And that's one of my favorite things about this treatment is I just feel like it just turns back the clock, but nothing that people, I don't look like I've had a procedure done. It just looks like I look really great or really rested or very youthful. So I've never had so many people ask me or I've never had so many compliments, I guess I should say, until I started doing this treatment. After I started doing this treatment, I really started getting a lot of compliments on how I look and my youth, the way that I got compliments that I look youthful, which has been amazing. And it really is a huge confidence builder. So a lot of times we do combine this treatment with other treatments. So we do the soft wave first, and then same day we can do filler, we can do neuromodulator like Botox right away after the treatment. And that's really great too, because you can get everything done in one visit if you would like to do it. And it's very, very easy. Like I said, after the treatment, you have no residual pain, soreness, heat. So it's just like getting a regular treatment, except you get an enhanced result. So we treat the whole face most commonly, but we can also break it up into different areas. So some people are really concerned about their brow coming down. So we just do a brow lift. We treat the forehead to give a non-surgical brow lift. We treat the cheeks. So when we treat the entire cheeks, the cheeks will lift. The cheekbones will become more defined because the skin underneath is tighter. The jawline will become more defined, and the jowls will be better, will be improved. We do a very quick procedure called the lip flip. It's simply 4 pulses, and I believe you're going to see that today. The lip flip, 4 pulses. We go right here, and the lip will turn out afterwards, and I'll show you an example of that. It's very quick. It's very easy. I have patients who will do this in combination with lip filler, and it is just fantastic for this area. And then, of course, we treat the gel area, which is included with our cheek treatment. So here's an example of someone who had their cheeks treated. And you can see that even by treating the cheeks, if you start at the bottom of the photo, you can see the neck looks a little bit tighter. You can see the jawline is tighter and more defined, and you can see the cheeks are more defined as well. This woman had her cheeks treated. Now you can see she has quite significant laugh or smile lines and laugh lines, but even just treating one treatment of the device, you can see it's tighter in that area. This beautiful patient had face and neck treated. You can see the neck has really contracted. The neck looks slimmer when you tighten it. So her neck looks slimmer, jawline looks tighter. Look at her cheeks. It's a very subtle difference, but it's more apparent in person. Look at her cheeks are more contoured. That's because we have tightened all the skin underneath. And then same thing with the jawline is tighter. So you can see again, this patient, I believe, just had her cheeks and neck treated, and you can see that the neck is tighter after treatment. Jawline is more defined, so her neck looks thinner because we have tightened it. So here you see the effects of her cheeks. So her cheeks were lifted. Look how when you lift the cheeks, it refreshes the area underneath the eyes. So there's less bluish discoloration underneath the eyes because the cheeks are lifted and are no longer pulling down. See how her lower face looks less heavy because we brought her cheeks back up to where they used to be. And see how her skin looks more glowy and looks more uniform in color on her cheeks versus it looked a little bit just not as vibrant in the baseline photo. And again, another beautiful patient. She had her cheeks treated. She had a really nice lift, no weight change, just a nice lift in her cheeks. She looks thinner because the lower face is less heavy and the cheeks are more defined and sculpted looking because they have lifted. In this patient, she had her neck treated. You can see it's contracted, it's lifted, jawline looks better. In this patient, first of all, look at the difference in her skin quality in this picture. Look how it just is more vibrant, it's glowy, it looks more youthful. This is 3 months after her first treatment, and you will continue to get results until about 6 months. Look how her neck looks contracted, it looks tighter, and then look at how her cheek lifted. So the area around the jowls, yes, I would love to put a little bit of filler in her cheeks to help with the remaining jowls, but it's less hangy, it looks tighter. If you pinched it, there'd be less volume there. And overall, she just looks really rejuvenated. And this is much easier to see in person, but look at this photo again, same patient, different side. We're seeing her cheeks are lifted. She now has some contour in her cheeks and the neck is contracted. And look at the beautiful skin quality that she's got after she has had her second treatment. This patient, again, you see her cheeks lift, the area under the eyes looks refreshed, and her lower face looks slimmer because her cheeks have lifted. Now her face looks more contoured. And again, jawline is tighter, softer around the jowl area. There's less jowl there. Her skin looks better. It looks more glowy. It looks more youthful. And her cheek looks more contour because we have taken it from down here and we put it back to where it used to be. For this patient, we treated some brow asymmetry. So look at her brow on your left side. Look how it's raised up to be more symmetric right away after treatment. And then after we did a couple treatments, look at the quality of her skin. Look how her brows have lifted more on the right side, or your left side, to worked more on the left side than the right side to make her more symmetrical. Look how her cheeks have lifted. She just looks even more beautiful in this after treatment. Here's an example of a lip flip. So when we treat the lips sag over time. The skin part between the nose and the pink part of the lip gets longer and stretched out. When we treat this area, we tighten it, the lips turn out after treatment. So you see the lips look bigger, but that's simply because we have tightened the skin underneath the nose and it turns the lip out. This is really beautiful. It's the equivalent or better of a Botox lip flip. And it also is really beautiful in combination with a Botox lip flip or in combination with lip filler. Neither of these patients have had anything but 4 pulses with the soft wave, and they just got a really beautiful treatment. Since this is a summer talk, we can talk about soft wave for the body, because who wouldn't want a better body with soft wave? So we safely and commonly treat these areas of the body: the neck, the arms, the of the knees, and the stomach area. These are areas where we can tighten the skin and we can produce some lifting. Here's an example of the neck. Look how her neck, her jawline looks tighter. Her neck looks slimmer. The horizontal necklace lines look improved. No filler, no laser. She just looks better. And this is one treatment of the soft wave. Here's a picture taken from soft wave Instagram of someone's belly, tighter and lifted after 4 treatments of the soft wave. This is where I originally went to try out the soft wave. This is a friend of mine's office in New York City, and they have this this photo posted of the back of the thigh. Look at this. This area underneath the buttocks drives many patients crazy. Look at that 3-month follow-up after treatment with soft wave. The lighting here is not super good. This is my knee after soft wave. So this is one treatment of soft wave, and I'm sorry it's not going up as well here. Hopefully you can see it better on your computer than I can on mine, but you can see the texture is really improved after a single treatment above the knee with the soft wave, which is super easy, by the way, and takes 5 minutes. Here is me. I actually had Maya do an Agnes treatment just on this side, and then we also did a soft wave treatment, and I got a really great reduction of that fat pad underneath, or that fat pad around my knee, and then tightening of the skin. And these are just with one treatment. So imagine doing more than one treatment in these areas. Here's me flexing my knees. You can see that the wrinkles are so much better after doing soft wave treatments. So I don't know about you, but for me, I was super self-conscious about this area. This is me today, by the way. I'm wearing shorts, and I had stopped wearing shorts or skirts. And so I started doing things on my knees periodically. I've done Sculptra in my thighs. I've done cool sculpting above my knees before. In the last year, these are my only treatments that I've done. One treatment of soft wave, and then just on the right side, one treatment of Agnes on my knee, where I had a little bit more residual fat in the area. And for me, it's the difference between not wearing shorts or skirts versus being very confident and comfortable wearing them. Here's your special. So soft wave for the face and neck. So this is a treatment in our practice. Maya, our nurse injector, our aesthetic nurse, and our estheticians do these treatments. And for face and neck, the cost is $3,500. For those of you who are sharing your Friday with us, we are having a webinar promotion of $2,000. We will ask that you commit to this today, by end of day, or throughout the weekend. If you email us over the weekend, we will honor it for you because it is late on Friday, and we want to give you the weekend to think about it. So you are saving almost 50% by treating your face and your neck. And I'm just a true believer in this. I think it's just one of these things. We can't expect surgical results from something that's non-invasive. There's not a single needle involved, but we do know that this works. And I just think I'm a huge fan. It's a game changer because of the collagen, the elastin, and the lift combined. And the safety profile, the predictability, and the reliability of this treatment. I think it's a great treatment for you. So we will pause and we're going to switch room and go into room set up with a soft wave. You will see how quick and easy a lip flip is. So your lip is falling down like this. It's curling under your teeth. And so that's why our lip disappears over time. When you do soft wave, you tighten this area, it's going to take the lip that's inverting over your teeth, it's going to tighten it and evert the lip just a little bit, but it everts it and it results in more lip showing. And it's a really great, easy, and safe thing to do. So pause for a second. Please, please, please think about doing this promo because I think you will absolutely love it. I'm going to pause the camera and I will see you in a moment. Okay, hi everyone. Thanks for hanging in there. So we are back in the soft wave room. This is Maya, our aesthetic nurse, and this is Sarah, our lovely medical assistant slash back office co-manager. And we're going to do the lip flip. Here's the lovely Pronox, and she just told me that she had used it and she was feeling a little bit affected by it. But I haven't seen her take a breath. So you seem very calm though. You feel she doesn't even seem nervous. Okay. This is great. So are you ready? You are going to see how easy this lip flip is. I have had this lip flip done like 3 times, I think, maybe 3 times. And I absolutely love it. And it's just so fast. You could easily add this on to one of your appointments as well, a Botox appointment, etc., laser appointment. So, oh, great. Okay.
Says softwares has been incredible for me. The results were instantaneous. My face is lit tighter with less, and I even think I was a little more glowy. I'm definitely getting it every year.
Oh my gosh, that's great. Thank you so much for sharing that feedback. Awesome.
Ready to start.
Okay, here we go.
Just a couple of pulses, and I'll distract you a little bit also. About 5 seconds long.
So that was her first pulse. Notice that we don't need to wear eye shields. That is awesome because it is not a laser. It's simply ultrasound energy, which is not harmful to the eyes. So super, super easy.
We have another comment.
Yes.
I love that there was no downtime, and the second time around was less painful than the first because I used pronouns. Maya is the best. She was so patient with me. The whole thing took like 45 minutes for my whole face and neck.
Oh my gosh, that's wonderful. Thank you for that. Okay, you guys,
Sarah's done.
that's it. So remember those before and afters I showed you. That is a result of the lip flip. And we will also send you in our follow-up email Sarah's results. How was it?
Not bad.
Not bad. You're so calm. You're just I didn't see. I was watching your hands. I was watching her to see if she tightened them up. Nope, she didn't move at all. So thank you so much for joining us. Have a wonderful weekend, and we'll see you next time.